myriad of documents that have been published talking about the effects of cannabis. And I shifted over from using the opioids to using cannabis and finally got some relief for the first time. But you were absolutely right. The majority of the people who were selling products back then had no idea what they were selling and definitely didn't know what they're talking about. And even as we get to today, we're still at a place where, I liken it to the Wright Brothers pushing a wooden plane down a hill. We've got probably 30 years before we're really going to catch up with the research that we should have been doing for the last 90 years, right?
Well, I certainly am not here or ever would defend what my colleagues have done in as it applies to preventing research. But my colleagues, the vast majority, I think, would be very interested in doing research in cannabis if the federal government would allow it to happen. It's on Schedule 1, as you well know, along with LSD, heroin, ecstasy. And if you have NIH grants coming into your facility, university, hospitals, whatever, and then you start doing cannabis research, you are at risk of losing all your NIH grants.
Which seems crazy, right? So the fact that we know now for over 40 years, we have been funding with taxpayer dollars research that's supposedly being done at the University of Mississippi. We've also been funding research in Israel. We've funded research under Dr. Meshulam and several other places around the world. Our federal government, our taxpayer dollars have gone to this research, yet that research is not available. In some cases, even today, we still, from the University of Mississippi, send out once a month canisters of marijuana grown at the University of Mississippi, yet they don't even track the patients that they're sending it to.
Well, it's not just that. The University of Mississippi grow site is trash.
Right.
And it has a very low percentage of THC. It is moldy. It is of no value. In fact, that's the reason why Dr. Sue Susley in Arizona sued the FDA.
14 years ago, I had Irv Rosenthal on my show, and I got a canister of his cannabis that they were sending him. And back then we knew, it wasn't 14 years ago, it was about 17 years ago, and tested back then some of the remnants that were in that can and recognized how bad that cannabis was.
Oh, for sure. It's just a demonstration that the politicians are trying to rule the way patients are treated. Just like they indicate or legislate the diseases that people can use cannabis for, called qualifying conditions. It is a tragedy because 200 million or more Americans have access to a drug, and the drug has been vaped, it's been rubbed, it's been inserted, it's been swallowed, it's been smoked,